Investigating a relationship between diabetes and ocular features is a timely research idea which has the potential to aid the increasing diabetic population worldwide in the long run. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Uncontrolled diabetes, also known as hyperglycemia, can lead to serious damage to many of the body's systems, especially the nerves and the blood vessels. According to 2021 IDF diabetes statistics, 537 million people worldwide suffer from diabetes. But the shocking factor is 46% of this diabetic population is undiagnosed. One reason for this significant unawareness among the diabetic population can be its delay in showing symptoms. Also, all the diagnostic methods or tests of diabetes, as mentioned here, being invasive can be another reason. Therefore, if a non-invasive diagnostic method is identified for diabetes, that would immensely benefit the diabetic population. So far, researchers have focused on ocular features in order to identify diabetes, and there are mainly two imaging methods which can capture the ocular features. Fundus imaging is performed using a funduscopy which can capture the retina of the eye, while scleral imaging can be done using a DSLR camera or even a mobile phone camera to capture the sclera of the eye. However, so far there is no medically established relationship identified or a consumer device implemented to identify diabetes in a non-invasive method. Therefore, a lack of relationship identified between diabetes and ocular features was recognized as the problem statement for our study. Moving on to the analysis procedure of the study, acquiring ethical clearance was a crucial step because it is a compulsory requirement to perform a data collection procedure including human subjects. The data collection was done in collaboration with two main institutions, the Diabetes Clinic of National Hospital Sri Lanka and City Lab Panthura. 57 diabetic group and 50 healthy group volunteers participated in the study. Altogether, 91 retinal images from the diabetes group and 855 scleral images from both diabetes and healthy groups combined were collected. Moreover, annotations were done to the collected data in order to help with the next step of the analysis procedure, feature calculation. Vessels were annotated in 20 scleral images and 20 retinal images. Branch points were annotated in 20 retinal images, and scleral area was annotated in all the 855 scleral images collected. The original images collected were pre-processed before extracting the vasculature using a unit framework implemented with 91% accuracy. A branch point detection model was implemented to identify the branch points of the vasculature with an accuracy of 86%. In feature calculation of the vasculature, 5 parameters were calculated for retinal vasculature, namely branch point density, tortuosity, branch angle, vessel segment partitioning, and vessel diameter. For scleral images, vessel tortuosity and blue chromaticity as a parameter of perivascular color were calculated. In data analysis, p-values obtained for all the retinal vasculature parameters from Mann-Whitney U-test and t-test were less than the significance level of 5%, indicating that there is a significant difference between the distributions of these parameters in the diabetes group and the healthy group. In the conducted principal component analysis, it is evident that PC2 is better at separating the two populations, diabetes and healthy, as shown in the plot. Also, PC2 is found to be highly correlated with the average branch angle parameter, suggesting that the average branch angle plays a significant role in the separation of the two groups along PC2. P-value obtained for perivascular color parameter in scleral images was less than the significance level of 5%, indicating that there is a significant difference between the distributions. However, the obtained p-value for tortuosity parameter was higher than the significance level, indicating no significant difference between the populations. Summarizing the study, we can come to a conclusion that promising results are observed in the use of retinal vasculature parameters as a key indicator for diabetes. This also validates the scope for using retinal images for early diabetes diagnosis. Thank you for watching.